Hello, everyone. My guest today is Michael Nusimov. He believes that technology can make healthcare more efficient, more personalized, and help provide healthcare to many more people. He co-founded his company, DrChrono, with Daniel Kivatinos in January 2009 and built the first ever native iPad EHR app. So we'll jump into it today. Michael, are you ready to take us to the top?
Yes.
Very good. By the way, is it Daniel or Danielle?
So it's Daniel Kivatinos.
Oh, I butchered that.
My co-founder's name.
All right, well, that's your co-founder's name. All right, what's the company do? What's DrChrono do?
So what DrChrono does, we kind of built the world's best electronic medical record focused on the iPad and iPhone. And that was our first real breakaway product that we launched right around when the iPad first came out in April 2010. And what an electronic medical record is everything that a doctor needs to do at the point of care with a patient. When they're in the exam room with a patient, they can do all of that work on an iPad or even on an iPhone, although an iPad gives a little bit more real estate to do a good job. And those are the types of things like viewing a patient's complete medical history, viewing a list of the patient's medications they're taking, their ongoing problem list. And also, it's really critical that they document. So instead of writing down on paper what's going on with their clinical visit or sketching down notes or using a desktop computer or even a laptop, they're able to do that all through touchscreen interface on the iPad. And everything else they need to do at the point of care, they can do on the iPad without paper, without a laptop, including ordering labs and radiology for the patient, viewing those results, sending prescriptions to any pharmacy in the US, including controlled substances, which are powerful pain medications. We're certified with the DEA to send such powerful prescriptions through the iPad and iPhone.
So, Michael, who's actually paying for this, though? Is it the hospital or the provider or who?
So we sell into what's called the ambulatory clinic market. And it's a little confusing to people outside of healthcare because ambulatory actually means everything outside of hospitals. I know ambulances take us to hospitals, but ambulatory is, the patient ambulates in and ambulates out. They walk in and walk out. So anything where, any clinic when the patient is not staying overnight, so regular doctor visits, pediatrics, and even things like ambulatory surgery centers where you go in and get surgery and kind of hang and go home. And just to finish the product, that's kind of the tip of our spear product is the iPad EHR, which is the clinical tool. And our big upsell from there, kind of the shaft of the spear, the follow through, is something called revenue cycle management, which is often shortened to RCM. And basically, that's all of the work involved in getting the doctor and clinic paid from the insurance companies and the patients. So it's really kind of end-to-end submitting a claim, dealing with rejections, modifications, all the way through, several insurances you may have, and all the way to the patient balance at the end. So it's kind of that end-to-end care of the clinical tools, but also the follow-through and our upsell where we generate the revenue is by taking a percentage of the revenue that we help the doctor and clinic earn from the insurance company.
So that's the only revenue model. That's the only way you make money. There's no SaaS product underneath this or anything?
So that's definitely the most important to us. We do just sell our software as a SaaS product. And that's where we started the business. And the rev cycle has really evolved in the last couple of years and going forward as being kind of our preferred model, because I think it's where we deliver the most value. We can generate more revenue and I think solve a deeper problem. And kind of I think of it as making it zero work to get paid with insurance, which is a huge hassle.
So Michael, sorry, I don't want to get too far away from the revenue stream for a second. So just to be clear, right now, if you look at your revenue over the past 12 months, what % of that is SaaS, would you say?
So probably around 2/3 of our revenue is still just from SaaS software.
Oh, okay. That's pretty healthy. And so what do people pay? The ambulatory kind of services there, what on average, what are they going to pay per month or per year for this? Just the SaaS side.
So for the software side, an average software per provider license would be roughly around $6,000 a year.
Okay. So that feels like, not too crazy, not too cheap, doable for most people.
Yeah. And one of the challenges with that is there are only so many providers in the US. So it's kind of a smaller market than you might think. There's about 1 million people with an MD in the United States. And only about 700,000 of those MDs who, people in the US who have a medical degree actually practice medicine today. The other 300,000 are retired or in research or I don't know what they're doing. But
what penetration do you have in that market?
A lot of those MDs are in hospitals, which we can't sell to. I'm sorry?
What penetration do you have of those 700,000?
So we have about 30,000 healthcare professionals. So that's kind of beyond the MDs to include the nurses and other staff members and professionals who use it. So we can sell to some people who are not MDs. For instance,
I see.
Nurse practitioners, physical therapists, kind of anyone, including chiropractors and anyone who really sees a patient and submits a claim to insurance. We can use our software, and the MDs are probably more valuable because they generate more revenue and kind of have harder problems. But in the modern, if you look at an urgent care center, which is a great example of an innovation in ambulatory care, they're a lot more efficient than an emergency room. And they don't just rely on doctors. When you go to an urgent care, you're much more likely to be seen by a nurse practitioner or a medical physician's assistant or med assistant, and they can really do most of what you need. So it's kind of becoming a broader market.
So Michael, sorry. So how many providers then are currently paying customers of what you've built?
Yeah, so we have about 6,000 providers and about 30,000 paid users overall.
Okay. What's the difference though? So I don't understand the difference. So if for example, if I take 6,000 times that 6,000,
sure.
that 6,000 per year price point you said, that would put you right now at about $3 million per month in revenue. Is that accurate?
No, we're probably at around a $23 million ARR rate right now.
Okay.
So probably is a factor of kind of discounts, and that's including our rev cycle business, which has, where we're taking a percent of revenue, and we tend to make several times more revenue than just software.
Yep. Okay, that's fair. But so of those 6,000 customers, then if you're kind of at a 23 million run rate, 2/3 of that is pure SaaS. The other third is kind of the other services that you provide. You're making, call it $300, $400 a month per 6,000 customers, something like that.
Yeah, and I would segment that because the RCM business, which is about a third of our revenue and has been growing really fast, that's only about 10% of our customer base. So to us, we have different customers that are worth, probably a pretty wide range of what they're paying us. We might have a small practice paying us, $100 a month for their software. And then we might have a medical doctor where we're doing their billing, where they might be paying us, $8,000 to $10,000 a month for rev cycle services. So there could be a lot of variation.
Of course, yeah. Yeah, of course. You'd expect that, right? In any big customer base. So if you're at $23 million in ARR today, help me understand growth. Where were you about a year ago?
We've been growing at about 50% year over year. So I believe we ended the year last year with about around 15 million in ARR. So, we've been targeting about 50% year over year growth for the last couple of years. And we've been on a pretty good trajectory with that.
And have you been able to do all this bootstrapped, or have you raised capital?
So the first several years of the company, probably 2009, when we first started working on it, through 2011, we were bootstrapped. In 2011, we joined the Y Combinator incubator and actually relocated to California from New York. And starting in 2011, when we started raising funding, to date, we've raised about 16 million in venture capital through a seed round and a Series A.
Yep. And you very specifically said venture capital. Do you have debt on the company as well?
Yeah, I think we've used some venture debt along with our seed round and with our Series A round. So that's something we're able to use to kind of supplement that equity financing, probably another $2.5 million in debt as part of those rounds.
Yeah, that's great. And when did you launch the company? What year?
Yeah, so we started working on it in 2009, and that's kind of when we launched our first web product. And we were bootstrapping it. Me and my co-founder were building the product and selling it and trying to do all the jobs at the company. And we got a lot of success in 2010 when we launched our iPad app. I think that was something that really set us apart. About way back in April 2010, when the iPad first launched, there were about 300,000 pre-orders for the iPad. And it was limited to like 2 iPads per household or customer. And about 10% of those, 30,000 of those, were sold to physicians. So really early on, physicians kind of saw that ability. In circa 2009, 2010, less than 3% of doctors in the US were using any kind of EMR. It was really not used a lot. There were still lots of paper charts. And there was a set of government incentives called Meaningful Use that paid out $30 billion over the last 10 years to really just giving incentives to doctors to start using EHR tech like DrChrono and others. And that really created an explosion of EHR vendors. And we kind of, there were kind of 2 waves we were riding then, the explosion of kind of mobile tech with the iPad, and also the explosion in just EHR tech at all, because, we went from an area where, as I said, 10 years ago, less than 3% of doctors were using any kind of EHR. Today, where, Medicare puts it at somewhere around 85% of providers are using this tech. So in 10 years, it's been a pretty massive period of adoption across a few hundred vendors in that space. And it's still changing drastically because 10 years is not that long of a time. It's
Totally.
still a relatively young industry.
Last few questions here before we wrap up, just because we're out of time. What team size today? What are you guys at?
So today we have about around 103 people in the US. We have around 70 people in California, most of those here in Sunnyvale and Silicon Valley. And we have a pretty large team on the East Coast with about 30 people in Baltimore, Maryland.
Great. So 103 people total, California and Baltimore. Very good. And then economics wise, so CAC, do you have fully weighted CAC for these customers? You know what you're paying to acquire them?
Yeah, well, we target, and I think it's a pretty good benchmark I've seen in a lot of SaaS businesses, which I still think of ourselves at heart. We target to recoup the acquisition costs in the first year. So kind of blended marketing and sales costs. Our goal is to always get that acquisition under a year of our customer lifetime value.
Yep. So good. If your average contract value is $6,000, you'll spend $6,000 to buy them or get the customer.
Yes.
And then what about churn? Are you above 100% net revenue retention or?
Yeah, for the last, I think it's been around 8 of the last 9 quarters, we've had a negative net churn. So we've been able to expand our user base beyond what we've churned. I definitely think, for us, about 60% of the gross churn that we do have is what I'd call involuntary churn, which is, a practice shutting down, providers leaving a practice. And I think that's kind of a reflection of the market we're selling into and a broader change in the market where, when we started the company 10 years ago, probably somewhere between, more than 60% of providers were in these smaller 1 to 5 provider groups. And today, or at least in 2017, I've seen data that, that's more of a share of about 40% of providers in ambulatory are in these kind of small SMB 1 to 5 provider groups. And a lot more of those providers are going to join larger practices, kind of in the mid-market from say, 6 to 100 providers, and even the really large enterprise market where you'll see it's very popular here in California, places like Kaiser and Sutter Health, where there's kind of these big HMOs that employ lots of physicians. So there's kind of a change in the industry we're seeing where providers are joining larger groups from medium to really large groups. And also, I think that's normal for a lot of SMB businesses. They're a little more fragile. They tend to have more churn than enterprise customers and larger customers and tend to have less,
it makes sense, Michael. You're right. You're right.
Mm-hmm.
I mean, that's a range I hear all the time. So that seems super fair, super healthy to me. Let's wrap up here quickly with the famous 5. 1-word answers if you can. Number 1, what's your favorite business book?
I would say one of my most recent favorites is The Hard Thing About Hard Things. I thought it was really honest about, what the startup experience is like.
Yep. Number 2, is there a CEO you're following or studying right now?
Yeah, I think I actually was listening to a bunch of your podcasts. I've heard this before, but Mark Benioff, I think, is a great CEO from what he's done with his company and even just how himself is a good head for his company and a good role model.
Number 3, what's your favorite online tool for building the business?
I'd say my favorite tool right now is actually Inbox, which is kind of sad because it's going away, but the Gmail Inbox tool,
yeah, sure,
which is going to be sunsetted soon. But
number 4, I know you have a new one there. How many hours of sleep are you getting every night?
So I really try and get about 8 hours of sleep a night. It's not always straight 8 hours through,
sure,
but I try and average around 8 hours.
And situation, I think you're married. How many kids do you have? I know you have one.
Yeah, so we just had our first newborn. He's 10 weeks old. So.
And how old are you?
So I'm 39.
39. Last question, Michael. What do you wish your 20-year-old self knew?
I think, I kind of at 21, I kind of graduated college and went to work in New York. I had a great time living in the city. It's I really love. But I do wish I knew the kind of opportunity that was out here in Silicon Valley, although I was 20 in 2000, which was right before a big market crash. But I do wish I'd kind of thought of that earlier in my career, is to come out to Silicon Valley and kind of get involved in the startup scene out here.
Guys, there you have it. Get out to Silicon Valley maybe sooner, faster, get more of that exposure earlier on. Launched his company back in 2009. They've now scaled about 6,000 customers they're working with, paying between $300 to $400 per month, doing about $23 million today in run rate. Ended last year at about $15 million in ARR. So healthy growth. They raised $16 million to grow the company, $2.5 million additional in venture debt to help scale there as well. Over 100% net revenue retention, team of about 103 people between California, and Baltimore as they look to scale DrChrono in the EHR space. Again, management and medical API platform. Michael, thanks for taking us to the top.
Thank you, Nathan. Thanks.